I have a mental health hot take. I don't like the word depressed. And it's for a very specific reason. Because I think nowadays we use a lot of clinical diagnosis as a way to describe our emotions and feelings. And granted, yes, this does help with getting the word out about all of these things. However, I think it's not doing what it was meant to do. When we say that we're depressed, a lot of times we're mistaking depression and sadness. Depression is something you've been feeling for about 2 weeks or so. Sadness is something that you're just feeling in this moment. And I think when we're using these terms, we're trying to bring awareness and alertness to the fact that we are having feelings. Everyone has feelings, and these are a totally unnormal thing to have. I think we've spent so much time trying to ignore feelings and trying not to pay attention to them that now that we are finally putting emphasis on it, it is great. However, there's so many other terms, and I think getting ourselves comfortable with a wider vocabulary for feelings is exactly what we need to do instead. Simplifying it to these diagnosable terms does not necessarily help convey what we are actually feeling. So yesterday I shared my hot take about how I don't like the word depressed. And if you didn't see it yesterday, it's because of the fact that I feel like there's a lot of other words that we can use to explain the feelings that were going on. And sometimes we just feel very limited in our language. So I'm going to show you one way to get a bigger vocabulary and one way that we can develop more emotion words. So as you can see right here, we're talking about an emotion wheel or a feelings wheel. This one's free on my website at arisainspired.com, but you can find many versions of this like this one on Google. And as you can see, it shows all these different emotions. It kind of has the basic ones in the middle. We're talking about happy, sad, scared, angry, all of that. But if you just zoom into one section, for example, if you zoom into that whole sadness kind of area, you can see that there's so many different words. And each word is a little more nuanced when we're talking about sadness. Of course, it has depressed, but maybe you're not feeling depressed. Maybe you're feeling isolated. Maybe you're feeling hopeless. Maybe you're feeling guilty or shame or some other one. When we look at the feelings wheel, this can help us really kind of pinpoint what we're feeling. So you don't have to memorize all of the words in the feeling wheel to be able to better understand what's going on in your emotions. When you are dealing with an emotion, maybe when you're trying to journal or reflect, you can take out the feeling wheel and use it as a way to conceptualize what's going on with you. So next time you're dealing with a tough emotion, use a feeling wheel. Let me know how it works for you. This week we've been talking about depression, and I don't like the word depressed to talk about just general sadness. My sticking point probably is because I have experienced depression. When you experience depression, like clinical, diagnosable depression, one of the biggest things to diagnose it is called anhedonia, which is like the feeling of nothingness. And a lot of times people are like, what do you mean by nothingness? And literally, you feel nothing. I remember specifically one day going through and doing some things that should have made me feel something. And for the most part, I felt absolutely nothing. I didn't feel happiness. I didn't feel interest. There was nothing going on inside when it came to the feelings. And I mean, that's just one of the major indicators, the idea of feeling nothing. Group that with fatigue and weight gain or weight loss and lack of sleep or too much sleep, you just feel like a hot mess. And that's what depression is. It is something that takes control of your life for a good amount of time. So that's kind of another reason why I have a bone to pick when people just say that they're depressed when really they mean sadness, because depression is serious and it really takes the life out of you. So we've been in this discussion about depression, and it's because of the fact that I don't like the word depressed and it being used in the way that it usually is. So today what we're going to really talk about is diving into kind of the clinical diagnosis of things. What are the symptoms? What do we look for when we're diagnosing depression? There is no depression technically diagnosis when we're talking about. It's under the category of major depressive disorder. As I'm going through this, I don't want you to take these symptoms and these things as a way of diagnosing yourself. I just like the knowledge to be out there. I want everybody to have a clear understanding that when we are talking about depression, when we're talking about diagnosing depression and understanding what it is, these are the things that we're clinically looking for. So as you can see here, we are looking at the different symptoms that go into diagnosing major depressive disorder or depression clinically. When we are talking about diagnosing, again, we're looking for 5 or more of these symptoms being present for 2 weeks or more. This is not something that you felt today and is gone tomorrow, but it is something that has been prevalent for at least 2 weeks. And when you look at these symptoms, you'll see the first two talks about being depressed most of the day or having diminished interest. If you saw my video yesterday, we talked about anhedonia and how that feels like nothing, like you don't have interest, you don't feel pleasure. That's what that second one is talking about. And in order for us to be diagnosing major depressive disorder, we need to have one of those two marked off in that 5 or more. And then if you look, these are the other ones we're talking about. The bigger ones we're talking about and maybe hadn't mentioned before is this feeling of worthlessness or excessive inappropriate guilt, the diminished ability to think, concentrate, or even decide on a day-to-day basis. I think that one is also kind of like thrown out the window when we talk about diagnosing, because we don't think about like brain fog as being a major sense and a major symptom of depression. But when you are depressed, you can't think straight, you can't figure out what you want to do, and you kind of feel locked in. The last one, of course, is plain and simple. Those who are dealing with depression for a long time may feel like this is their only option, this one at the bottom. So again, when we're talking about depression, it is not just sadness. We're talking about a combination of symptoms that actually vary from person to person. So one person saying that maybe they are feeling major depressive symptoms versus someone else, their combination is going to be different. This is just to give some information out. Do not use this as a way to diagnose yourself, but I hope that this was super helpful when thinking about what is sadness and what is depression. Here are 3 things that you can do this weekend to help with your depression. Number 1, go outside and move. This could be just a short walk, or it can be some major exercise like a jog, or even some like outdoor yoga. Exercise has been shown to increase endorphins and help regulate stress, and just being outside reduces our cortisol and helps with positive affect. Number 2, journal. Whether you journal on the regular or just journal when you're feeling like it, journaling has helped with emotional regulation. And if you struggle with journaling prompts, you can Google some, or you can check arizainspired.com because I just uploaded some journaling prompts for free. And last but not least, get some support from your friends. Go hang out, go do something fun, but having that support system and those positive people in your life can help you feel better. So I hope you try one of those things this weekend, and if you do, let me know.